Welcome everyone, and thank you for joining us today for this next session of Med Virtuals Ideas for Today and Tomorrow. We had great support and a lot of feedbacks, positive as well as suggestions, which came from the last two sessions. And taking all of them together, we have planned the session today. We are going to start with the introductory remarks by Dr. Deepak Patkar sir and Dr. Shashank Patil. After that, we'll be having a short talk by Dr. Naveen Kirti on pathways to GMC registration. And then we have two eminent doctors, Dr. Deepa Shinoy and Dr. Deepa Srinivasan, today sharing their experience, their journey from India to UK. And at the end, we are going to take your questions. So stay tuned, and whatever questions, queries come up to your mind, please do share with us. Do post your queries in the chat box, and we are here to answer and help out. So this is a time to welcome our mentor for this program, Dr. Deepak Patkar sir. Sir is someone who does not require any introduction, especially when we are talking about radiology. And sir was is the immediate past president of IRIA, Director Medical Services and Head Department of Imaging at Nanavati Super Speciality Hospital, Mumbai. He has nearly 33 years of experience in the field of radiology with key roles in diagnosis as well as in also in administration. We welcome you, sir, and over to you.
Thank you, Bitusha, for kind introduction. Good morning, friends. With great delight, I welcome you to today's session by MedVirtuals. MedVirtuals is a digital online platform where we shall provide educational material and information covering various topics in medicine. The courses are specially designed to help students to prepare for various exams conducted internationally as well as nationally. We have also designed a series of carefully crafted lectures on different topics of medicine, including case-based reviews, quizzes, and question-answer series. One thing that is common about all the Indian medical students is that they would like to expand their horizons and travel to different countries to broaden their knowledge and sharpen their skills. One such popular educational destination or Mecca for Indian students is the United Kingdom. I'm sure all of you and many more students from our country would like to visit this beautiful country to gain more experience and knowledge, but miss the chance to do so because of lack of knowledge about the details of availability of opportunities and rules and regulations that this country has. Thankfully, today we have our esteemed panelist, Dr. Shashank Patil, Dr. Naveen Kirti, and two Dr. Deepas, who will share and provide important insights and details of the process for applying and studying medicine in the United Kingdom and career prospects that this country has. We at MedVirtuals are extremely grateful to them for contributing their valuable time and experience for this session. This is the third session by MedVirtuals. We shall be addressing different modalities each time. Today's session covers two important specialties, that is pediatrics and Gyanec. As the number and popularity of these sessions continues to grow, we have almost 429 people registered today. We request you to spread the word about MedVirtuals across your peers. Thank you all and look forward to a great educational session. Thank you.
Thank you, sir, for always being there as a guidance and for the force behind all this work which we are doing as a team. Now it's time to welcome Dr. Shashank Patil, sir, another key person who has been instrumental in formulating everything MedVirtuals is about. Sir is alumnus of BYL Nair Hospital, Mumbai, and he has membership in surgery and fellowship in emergency medicine from the relevant royal colleges. He is consultant in emergency medicine at the Chesla and Westminster Hospital, London. He is director for emergency services there and senior clinical lecturer at King's College, London, senior clinical lecturer at Queen Mary University, London, Northwest London lead for National Institute of Health Research, co-chair for the London region at the Royal College of Emergency Medicine, and he has keen interest in clinical research, healthcare, informatics, and management. We welcome you, sir, and over to you.
Thank you, Metusha, and for the very generous introduction. Thank you. And I should say, firstly, many thanks to the to Dr. Patkar and his MedVirtuals team who have put relentless effort to get these webinars. I think it's a great initiative. Um, we as a team of doctors, as you can see, my colleagues here and my friends, I should say more than colleagues, Naveen, Dr. Deepa Shenoy, and my partner, Dr. Deepa Srinivasan. We guys have been through this journey, and our journey started about 15, 20 years ago. And we had challenges when we moved to United Kingdom to pursue our postgraduate qualifications. And we learned a lot. We faced lots of difficulties. It was a time when internet was not freely available. You don't know that many people. There's not a huge Indian diaspora. And we were the few lucky ones who managed to um, get on and find our feet with great difficulties. And I think one thing where we could actually make a difference. I know we have all the medical knowledge and you have access to books, textbooks, lectures, but where we can hugely make difference is making sure that the journey, if you decide to go on the journey we have been 15, 20 years, we can actually make it a bit of a pleasant experience. And like some of us that had different challenges. And between all of us, this engagement platform is a reason primarily for you guys to understand, because we have these questions and it keeps changing according to regulations. But the whole idea is today, to understand how you can actually pursue a qualification, a higher qualification, or a career in pediatrics, then similarly in obstetric and gynecology, and what your options are to do subspecialty or super specialty in these two particular major medical learning branches. And Naveen here has been doing a great work around actually helping doctors who come over here and making this journey a swift journey, and he will talk about it as well. So without taking too much time and moving on with the agenda, because this is why you're here to listen to my colleagues. So once again, many thanks to MedVirtuals, and over to you, Mitusha, to continue with the agenda. Thank you.
Thank you, sir. And as sir said, we are here to welcome our first speaker for the day, Dr. Naveen Kirti. He is doctor and entrepreneur in UK, parts of the NHS England's Clinical Entrepreneur Fellowship Program, team doctor for Silverstone Circuit covering their Formula One and MotoGP events. He has worked with NHS predominantly in the trauma sector and team leader for the 2018 TEDx NHS event. Mini MBA from Stanford University, co-founder of doc2uk.com, which is an innovative digital recruitment platform for NHS hospitals to recruit high-quality doctors directly from overseas. We welcome you, Dr. Naveen, and over to you.
Thanks, Matisha, for the kind introduction. I had a slide for that. No, I'm not going to run through it. Is that okay if I share my screen? So I'm kind of giving myself like around 8 to 10 minutes. So I'll just run through about us and then what we do, and then mostly about my journey.
Yeah, sure, sir.
Everyone can see this?
Yes.
You can see the slides, right? Right. Here, basically, predominantly what you've just said, I'm not going to go through it again, Mitusha. I'll move quickly into actually, what happened. As Shashank was mentioning, I'll just run into some quick stats. This is directly from GMC. So as part of the NHS programs, we have been given this access to directly go and spend a day in the GMC office, understand the journey and the process of overseas recruitment. Particularly how GMC registers, what are the conditions they have, how they validate certificates, how they validate your passports if they have to require, and see. This is back in 2005 when I came, and it's been 15 years now, or 16 years, a long journey. These are just the number of doctors who had come from India who have registered with the GMC as overseas doctors. So almost 4,000 doctors have come in 2004, followed by 3,400. And then drastically it dropped. Now, as you can see on the right side, it's gradually increasing. Most recent figures, we had a James representative come and present in one of the events at Medmaterials last month, in fact, or 2 months ago. And then they were giving an update. This number actually 2019 and 20 has gone significantly higher up. So you will not be surprised that we possibly come in to reach something like this. This chart indicates over the last 30 years, overseas doctors coming and registering from across the world with the GMC, not just from India. So again, as we've seen, out of these 12,000 doctors in 2003 and 6,000, half of them have really come from, or most of them have come from India. So the rest of the half comes to be from other parts of the world. It has stopped, but then as you can see, it's going up all over again. So, and the reason for this is basically this. This is like the current demand or the need in the GMC. So this is the waiting list for average treatments, diagnostics, management plans, and appointments with a specialist. It is going up ever so in the GMC and within the NHS in the UK. And this is the cost to the NHS almost per year in terms of like providing and compensating for these services. They have announced that this is the data from the NHS Digital, almost a shortage of 9,000 hospital doctors and 4,000 to 5,000 GPs. GPs are primary care physicians here in the UK. That is the current requirement of doctors in the UK now. And on top of this, there are almost around 50,000 nurses requirement. So NHS is struggling because of the staff shortages. I mean, this is where comes actually Dr. UK. I mean, I'm not going to talk more about Dr. UK. While I was part of this NHS clinical entrepreneur program, what they have, can you hear me? So as part of this program, I went to the NHS England and said that, right, as Shashank earlier mentioned, when I came, I remember those days. It's not just me, actually. We are a small group of friends who came. Luckily, we came in a small group. So it made it a bit easier that you share the hardships. Difficulty in finding your way into your accommodation site because there was no hospital, no job opportunities. I had to come and do the PLAB exam. And finding your bank account. Banks say that we need address proof. Even now, it remains the same after almost 20 years. So when you first come, where do you find your address proof? Address proof essentially is like your electricity bill or your phone contract bill. And we didn't have any of them. And you can't open a phone contract. So for me, I took my friend's phone. It's like a pay-as-you-go in India. And then I called my mom, Mom, I'm good. I'm safe here. Gone, £10. And it's a lot of money back then. When I came just with £1,000 in my pocket, £10 gone just to say hi, hello to my mom. And going into a shop over here to try to find and buy a duvet, like a rug in India. I didn't even know it's called duvet. So I said, like, can I buy a rug? Can I buy a rug? And they said, like, we don't sell rugs here. And it was like £32. And I thought, like, 32 is like, I used to work in Apollo before coming, half of my month's salary. I said, like, no, I'm okay. I'm thick skinned. But it wasn't that easy to survive in the cold. And this is just one part once you enter into the country, and then remains the other part, like finding your job in, and even more trickier actually than ever. So I realized and believe actually my next slide kind of shows it's like progressing in your career. Once you come into the country, for us, it's like if you're in the government college in India, so the ultimate is like you have associate professor, deputy professor, and then the professor. So, or in the private hospital as a consultant, you could be the junior registrar, senior registrar, you could be a junior consultant and get to be the consultant. So getting into consultant post is quite hard, particularly as an overseas doctor. Average, you have like around 3 to 4 years lag compared to a local doctor or a UK trained doctor. So we started Dr. UK with the intention to see that, right, we help them on the first steps, any overseas doctor who comes like us, help them find the job, and then support them with the career progression. Just basically, I'm not going to make recommendations, call the consultant and say, give our doctor a job, or like make them a consultant. No, we cannot do that. Nobody can do that. But then give these doctors the information, most important, which we didn't have. Be the mentors in a way that you support them so that they progress well in their careers. Something like what we Shashank, and then we never had the opportunity for. That is how Dr. UK started. And these are the hospitals we currently work with, where we introduce doctors into these hospitals. So they settle in first and then further move on in their career. We are associated with multiple NHS bodies because we have done it well. And then the intention was clear. We are part of NHS Confederation, which kind of, or NHS Employers, which is the recruiting body, is part of the NHS Confederation. And I'm part of the NHS program, so ISO certifications. This is the faculty of like all medical leaders, medical directors, clinical leads, and service directors. So we engage with them. As I said, at GMC, we are a bit associated with them because they come to our events. In fact, when we had an event in India, so the GMC head of overseas registration, they flew to India and then gave like all the information required for doctors for a quick registration. Very briefly, I'll tell about the paths to. So just like MCI, we have Medical Council of India. Over here in the UK, we have GMC. Every doctor who wants to come and work and practice in the UK, they have to register with GMC. And then the second step is like getting the visa. Nowadays, visa has become super easy because, as you saw, there's a big need or demand in the UK NHS. What it took earlier, like 2 to 6 weeks to get an overseas doctors or healthcare staff to get in work visa. Now our doctors have got it in like 4 to 5 working days because NHS made it easier. So the Home Office or the UK border agency, they made it easier, particularly for the healthcare visas. I have to mention, by the way, there is a rule which has come just this week that NHS has suspended overseas, particularly from India, doctors and nurses recruitment temporarily given to the COVID environment. I'm sure like once the COVID settles down, a few months, definitely not few weeks, the recruitment will start all over again. So be mindful of this fact. It is just about in the news as well, but then it will be advertised in NHS employers and other websites soon. Coming back into GMC registration, this is like how a doctor progresses and starts their career here in the UK. There are two main parts. I came by the PLAB, if I'm not wrong, Shashank came by the PLAB as well. And then, I need to hear from Deepa as well, both the Deepas. I assume that they came by the PLAB as well. That is one registration. Second is, and you need to pass. By the way, this is the clinical side. GMC wants to know only 3 things. Number 1, have you qualified from an medical institute or a college or a medical school, which is on what we call as a WDOMS list that is run by WHO. WDOMS stands for World Directory of Medical Schools. Almost 99% of Indian medical schools are on this list. So anybody who graduated, I would kind of be confident to think that, yes, you're on that list. So you should not worry at all about it. But otherwise, you just type in WDOMS and your medical school, you'll be on that list. You can verify that. That is number 1 criteria. Second, understandable. Your knowledge has to be on par because obviously you're dealing with English speaking patients, irrespective of the fact that we have been taught in English. Our patient interaction has been in the native language. It could be in Hindi, it could be in Telugu, it could be in Malayalam, it could be in Kannada. So we still have to do this English language test for GMC to accept our registrations or give us the registration, which is either OET or IELTS. For OET, you need to get to a level B, IELTS 7.5 out of 9. And then the third aspect is like your knowledge is on par with at least finally a medical student here in the UK who qualified in the UK. And that is assessed either by a lab test, 2 parts. One part 1, you can do it in India. Part 2, you have to come and do it in the UK. Or the second one is the Royal College membership. Nowadays, this was not prevalent when we came into the UK. So anyone who have completed a medical Royal College exam, it could be MRChem, MRCS, MRCOG, MRCPCH, FRCR, any Royal College exam, because all these colleges have been conducting exams in India, you're good to go. And particularly if you meet OET or IELTS and WWMS, GMC gives you the registration. So the MTI route is a complex route. It's only very few hospitals do this. We are not actively engaged, so I cannot really speak too much more about it. But I know it's a bit of a convoluted route in the sense like your visa is restricted to just 2 years, after which you will have to go back to India. And these 2 years is not accounted towards particularly somebody who has passed to stay in the country as a permanent resident or citizen. And not all hospitals, although it says medical training, I am sure, we can talk about MDI, a complete whole different session later on. There are some programs like universities which conduct MCH and MD, DM, clinical medicine, but they charge almost £30,000, average 15,000 to £30,000 per year, and they are 2-year programs. I do not recommend, I would rather suggest do an membership exam, because it always stays in your career and then you don't have to pay this fees to come and work in the UK. I think I'm coming close to my 10 minutes, so I will not talk more about it, but except for this one quick slide. This slide says, this is undergraduate training, how the journey happens for the UK doctors. Once you finish your undergraduate training, this is our final year MBBS. We do 1 year of internship, but then they do 2 years equivalent of internship. It's called Foundation Year 1, Year 2, during which you usually rotate through, like, instead of we do like community medicine, pediatrics 2 weeks, and then orthopedics 2 weeks, medicine 2 months, gynecology 2 months, and surgery 2 months. They do like almost 6 to 8 trainings of 3 months each. So you have kind of a decent understanding where you want to head towards, medicine or surgery. Then they apply what it's called as CT1 or CT2, CT1 or core training, or now it's called IMT, where you choose your pathways, be a medic or be a surgeon. Or you can do in some specialties like A&E or acute emergency medicine or in radiology, go through a seamless 6 to 8 years of training all through. And this particular specialty trainings, like say I wanted to do orthopedics. So all my colleagues who have done foundation training, they have done core training 1 and 2, and then orthopedic training from ST3 to ST7. So since the time they have graduated, 2 years plus another 8 to 9 years. So by the time they become consultants, it's like almost 10 years since their final year medical school exam. But for us, if you do after house surgery 1 year, 3 years MS orthopedics, and then depending on your work experience, hospital where you work, you can be a consultant. But over here, it's quite elaborate. When we do MD, MS in India, we have to recognize where exactly you fit in. Want to get into training over here or in this path, because like we have this equivalent experience, but then they cover varied specialties. For us, it's like exclusive in one specialty. So how do we compensate when you come at this level is something we need to, or you guys need to understand and decide. And then that leads into GMC specialist register. GMC have got 2 registers, one for specialists who finish training and they can work as consultant, or just a normal register. That is where you get your specialist register and you become a consultant. In one of the next virtual sessions about exclusively the training and non-training pathways, I think we'll have a run-through session. I'm sure Dr. Parker and Amit and everyone else will coordinate that. I won't say go more about this, and this is actually where we are invited by the OET team as well. And this is our doctors who had come and then spent the Christmas. We have association with, as I said, the bank. So the Barclays Bank come and open the bank account for the doctors at their hospital or nearby centers on the same day. So not the troubles what we have had. Yeah, there I stop. Guess I'm around 10 minutes, hopefully. Matisha?
Naveen, if I may, could you kindly mention about the registration, especially because participants are pediatrician and gynecologist. Mention about how to get GMC registration if they are in India. You said about PLAB, but can you just say a few lines about MRCPCH, what exam availabilities are in India, and what is required to get a GMC registration? And same for the RCOG, please.
So it applies in what I mentioned earlier. So there are three essential criteria to get to work in the UK or get the GMC registration. One, World Directory of Medical Schools. Two, IELTS or OET exam. Your English is on par with the English-speaking doctors, so because all our patients are English-speaking. Three, do your MRCOG or MRCPCH exams, all parts. Currently the situation is like for most of these practical exams, there are not enough appointments. And I was in one of those Royal College events as well. And because of the COVID and the pandemic, the number of appointments available are significantly restricted for overseas doctors. I mean, I guess I can understand because there are UK doctors who have to progress in their career path, and then they have given a bit preference to the UK doctors first in terms of the practical exams. But I'm sure it will change with time. So everybody has to pass all parts of their Royal College, respective Royal College exams. So MRCPCH and MRCOG. Once you meet these three criteria, then you can progress and get your GMC registration and apply for the jobs anywhere. There is a significant need in both obs and gynae and in pediatrics as well. I'm sure actually, both of the DPAs in their respective specialties, they can concur and then speak a bit more about it. I do not have the exact numbers, but these are the three essential criteria. With just part 2A or 2 out of the 3 parts being done, can they get GMC registration? We inquired, given to the shortage in the examination slots available, would GMC do that? But then they said no, at least until now. Will it change in future? I do not know, but then we are in active engagement with them. We will inquire, but I doubt it is going to be such straightforward. They have set the standard, like you have to pass PLAB exam. You have to pass, because post membership exam, everybody is working at a registrar level. So they have an element of responsibility to make a decision to let the patient go home. Unlike a PLAB doctors who are like usually the junior doctors who are just a support system. So WDOMS, IELTS OET, and then MRCOG or MRCPCH, all parts to clear.
Thank you. Over to you, Mitusha. Thanks.
Thank you, Naveen sir, for all these wonderful guidelining tips. And now we move to our next speaker for the day, Dr. Deepa Shenoy. Ma'am is consultant pediatrician at Dorset County Hospital, a pediatrician with special interest in cardiology and cardiac lead for the department, co-lead for medical student teaching. We welcome you, ma'am, and we are here to listen to your journey from India to UK. Over to you.
Thank you, Mitusha. Just going to try and share my screen now. This always happens. Somebody has to have the problem with sharing the screen, and it's always me.
Yeah, it has started. It has started. Screen share has started.
You can see that properly now?
Yes, you can make it full screen, slideshow.
Yeah. Lovely. So Mitusha has already given the introduction, and I think I'll mainly be talking about my journey here, and I think it's been touched on and shared about different people's experiences, but this is my own personal experience coming over here and working over here. I'll also briefly talk about the pediatric training options, which is available for trainees coming from overseas. And I think the other big factor is you're making a very big decision about leaving your home country, coming over here. So there are other important considerations, and hopefully sharing my experiences and my views of what the practice is and what the setup is over here would help you in making your decisions as to whether it's the right move for you. But at the end of the day, it's your own independent decision around these things. But hopefully the experience which we share would be helpful in you making that decision. So in terms of my journey over here, so I qualified from Bangalore Medical College in 2002. And I think how at the setup at that time was we had a big split in terms of what people wanted to do. I think a third of my people in my batch wanted to come to the UK and work over here. A third wanted to go to the US. So we had a group which was preparing for MLE exams. And I think a third of them just stayed back and prepared for the exams in India. And we came here in 2003. So it was a group of us just land up at the airport. And we had backup of our seniors who had already come over here to come and pick us up. So the scene is completely different. And I think what Naveen and Shashank and all of them have set up is really valuable, because we didn't have the luxury of having people to guide us or take us through the whole process as it is. We just landed up, and then we had to find our own feet and find our own way in terms of doing things and moving forward. So it was a PLAB exam which I had to give. So I did my theory PLAB exam in India and came here to do the PLAB clinical exam. And there was just 2 courses which was available. So all of us landed up in this place in London called as East Ham. But in a way, it was nice to meet up different people from different parts of the country who were all doing the same situation as us, preparing and working together towards a PLAB exam. And once you pass the PLAB exam, the difficulty at that time was finding a job. And you can't really apply for a job and get your first job. It's always having that first job, which is the most important thing. And we did something called as clinical attachment at that time, where you'd just be doing an observership as part of working with another specialist. And I got my first clinical attachment in a place called as Bedford with the president of the BAPIO. So he was an ex-president, I think now, Ramesh Mehta. And I got very lucky in terms of meeting him right at the beginning, because he was a mentor figure who sort of helped me with my jobs. So I got my first standalone SHO post over there. And because of being lucky with who I met right at the beginning, I think my training was fairly straightforward in a way. And I didn't have a lot of difficulties as a lot of people with finding that first job. And I think it's having that contact. And I think having people to guide you to meeting the right people is really important. And the setup they have at the minute to have that initial bank account set up, having that initial sort of support, who do you meet, how do you go through the whole process, is really helpful. And I think we did not have that at that time. All we had is our seniors or people who've actually done it talking through to us, and they didn't have too many years of experience of working over here. And once I had that first job, we did something called as an SHO job, which is a senior house officer job, which you do right after you finish your foundation training, which Naveen has explained, it's the equivalent of doing your internship back in India. And with the SHO standalone jobs, it's generally a 6-month job or a 12-month job based on where the placement is. And it'll take you a good 3 months to actually start doing the job and understand how the whole system works. And by the end of that post, you have to apply for another job. So there was a constant move from one job to the other job. And although the UK is a very small place compared to how India is, you still have to travel to another place wherever your job is. So every 6 months, you have to just pack your things up, get used to things, and then you'd have to move and just reset up in a completely different place. But what the NHS did is they started the run-through program. And with the run-through program, it's made a huge world of difference in terms of how your training is. There is a national number. So previously, when I applied for the run-through training program, they had deanery specific applications. So you have different deaneries across the country. So you have London deanery, you have the deaneries in the southwest, you have the Wessex deanery, and up north you have different deaneries, Midlands and the Northwest deanery. So there are different areas over there, and you had to apply based on where you wanted to work. And I applied through to the Wessex deanery, and I got a specialist pediatric training number in 2009. And the nice thing about it, so I entered the training program. I'll talk a bit more about how the whole training program is, but I entered at ST4 level. So that is your registrar level. And you have to have, so the criteria for entry into the ST4 level is you should have had all your membership exams, and I'll talk very briefly about the membership exams as well. And when you do your training, you can sort of choose to do the standalone post where you want to do or what special interest you have. But once you enter the run-through training program, there are specific requirements in terms of how many years of general pediatric training you do, or how many years of neonatal training you do, and how many months of special training you do. So because my special interest was cardiology and a few of my standalone posts were in pediatric cardiology, I chose to do that, and I did 2 years in that, and then went on to do more of pediatric intensive care. And once you finish your training through the run-through system, you get your completion of your certificate of completion in your specialist training. And once you get the CCT option, you are eligible to apply for consultant posts. And that is the main training requirement, is getting through that thing and coming out at the end of your exam. And you also have the exit exam, which was started with the specialist training program. And the exit exam, unlike other college exams, the pediatric exit exams are not as hard because it's part of what you're doing in terms of your day-to-day job in a way. So there is a lot of emphasis in pediatrics about managing children, as you would expect a pediatrician to do. So just talking about the pediatric training options, which is available to all of you. So it is a national run-through training post. And like I mentioned, the run-through training post takes away a lot of your difficulties about finding your next job. So once you enter at your specialist training level at level 1, which is ST1, pediatric training is probably the longest training because it runs all the way from year 1 all the way to year 8. But because it's a competency-based thing, you don't have to really go all the way up to ST8. If you've got all your competencies completed by ST7, ST6, even sometimes, you can finish your exams and come out through the other end a lot earlier. But it is a very long drawn program. It is an 8-year program. Just to, if you compare it with your MD, which you do in India, or the MD, which you do in America, it is a much longer program, but that has your core training. So ST1 all the way to ST3 is core pediatric training, where you do a year of general pediatrics, and you might do 6 months of 2 specialist placements, and then you do 6 months of neonatal training. And once you've done that core competency is when you enter into your ST3, ST4. So the main essential criteria to enter at ST4 is you need to have your exams. I'll talk briefly about your MRC PCH exams. It hasn't changed very much. The names have changed since I've given it a long time back, but the format is essentially the same. And once you enter your ST4, you can sort of choose what you want to do, whether you want to just CCT as a general pediatrician, going through the remaining 5 years of the ST program, or if you want to do a subspecialty training, it's called as a grid training program. You can choose your own subspecialty. So you have subspecialty in pediatrics in all different areas. So you have allergy, you have respiratory, nephrology, neurology, cardiology, endocrinology, diabetes, infection. So you can choose your subspecialty of interest. And that you think about doing it at sort of ST6 level, that's your specialist training, ST5, 6 level. And the grid training varies from the specialty. So I think pediatric cardiology is probably the longest, and probably the reason why I didn't want to do the grid training is it is a very long drawn process, and it is highly competitive. The grid training program is highly competitive, and there is just 4 training posts for cardiology, but different specialties, subspecialties have different training numbers, and other specialties generally it varies from 2 to 3 years. Pediatric emergency medicine is another subspecialty, which it is a 2-year program, so it's becoming something which is very popular with training. And as part of subspecialty, there is a lot of focus on academic training as well. And with how education is right now, that is another popular option with trainees, is sort of improving educational needs and taking the academic training posts. And for pediatricians who don't want to do a subspecialty, there are spin modules. So that's essentially what I did. So it wasn't called a spin module at the time I did, but you can do at ST5, 6 level a subspecialty interest. So your CCT would essentially be in general pediatrics, but you can have a spin module attached to it. So if you do it in cardiology, you become a pediatrician with an expertise in cardiology. So you'll have all the training from the pediatric cardiologist because you work in that particular specialty. And generally, these things are anything between 12 months to 18 months. But you can also do your spin module at the end of completion of your training. So you can do it post CCT. And that, again, can vary between 12 months to 5 years. So it depends on how long you want to train as a do your spin module and how long you want to specialize in that subspecialty. And the other option, apart from if you don't enter through the run-through program and if you don't CCT, there is the other option of the CESR route, which I think Deepa would be talking more in detail as part of the obs and gynae training as well. So it's your certificate of eligibility for a specialist registrar post, and it's mainly doing the same, getting to the consultant level, but in a slightly different route. So you're not in the run-through program, but you're doing all your other assessments, you're keeping all your competencies up to date, but essentially getting there. And all of this information is there on the Royal College website, and it's part of a webinar. So you can, for more information on this, you can always have a look at that. And briefly touching on the MTI scheme, which Naveen mentioned, is this essentially is for people who've done their post-graduation and people who've done your MRCPCH clinical exams. And it's a 2-year fellowship. And I've seen people who've done the MTI scheme, and it generally works for subspecialty placements. So I've worked with MTI trainees who've done neonates or who've done pediatric intensive care. And it's not an option for people who haven't done pediatrics back home, because it's not about coming and learning the skills over here. I think it works as a two-way process because of the shortage of staff here. They come and sort of impart the knowledge and their skills which they've got, and at the same time they get trained with specialists in that particular subspecialty. And the other essential things which Naveen has already mentioned is having your IELTS or your occupational English test. And in terms of how you apply for the MTI scheme, is you have to apply through the NHS Jobs website or your BMJ website, and you work closely with the trust and with the Royal College as well to get a place through the MTI program. And in terms of the MRCPCH exam, and I think that, again, just with my own experience, it might come as a bit of a shock in terms of how the whole exam process is. It hasn't changed in terms of the theory bits of the exam, so it's got different names now. Previously, it used to be MRCPCH Part 1 and Part 2. So the Part 1 had 1A and 1B. The Foundation of Practice is the 1A paper, and 1B paper was Theory and Sciences. And then as part of the MRCPCH 2, you had the theory exam and you have the clinical exam. And the clinical exam, so theory, I'm sure most of you would be able to sort of have the knowledge to do the theory exams. And I think I'd focus and stress on the clinical bit of the exam, because it'll be very different to the exams you generally give, because there's a lot of emphasis on showing what needs to be seen. So it's almost like your driving exam. So it's not important for you to just be able to drive. You should be able to see, to show how much you know about the driving. So if you're going to start your car off, there is the MSM rule where you have to look at the mirror, signal, and then do your maneuver. But if you haven't really shown your driving instructor that you've done those 3 steps in the way it's meant to be done, you wouldn't really pass your exam. So the MRCPCH clinical exam is a very similar thing, where you have to learn the nuances of how you do the exam. And I think I'd focus on that, because it's not something where you need to have a lot of knowledge around the fine prints. It's more about how you sort of come across during the examination. And in pediatrics as such, my whole experience is I've seen trainees who might struggle with the exam, mainly because say you have a child and the child is upset during the exam. You're not really expected to do the examination. If you just say, well, the child is upset, I'm not going to traumatize the child by examining the child anymore, that would be seen as an acceptable level. There is no stress on actually upsetting the child or having your clinical findings there. And the last bit of it to conclude is, on the whole, in terms of my whole overview of the training and my experience over here, is I think as a trainee you have to be flexible, because when you are placed in your run-through program, although I was in a smaller deanery compared to London deanery, which is much, much bigger, you have to be flexible enough to travel from one place to the other, and that might be a 2-year commute. So your home might be in one place and your workplace might be slightly further off. So you have to have that flexibility. And over here, there is a lot of emphasis on governance. So documentation and what is being said to the patients, it all has to be documented efficiently. And I think that might be one thing which we better think about. And in terms of part-time trainees, and I think all of us have gone through that route, especially female trainees, there is always the commitment you have towards your family. And I think you do get good support being a part-time trainee, and there is a lot of flexibility to do that in your own time. So the training program is already long, it's 8 years, but if you're a female trainee, it's going to be even more prolonged for you, because you're going to take out a year for your maternity, or how many times you have, how many children you have, you're going to take out time for it. But there is support in place for that. And I think when you're taking time out, when you come back, you get a bit more of support to get back into training. So I would emphasize on that. And I think on the whole, there is a bit of good work-life balance. If you've been a consultant for a whole week, at the end of that week, you can actually sign off and have your weekend completely off without having to worry too much about what is happening at work. And you can be rest assured that people will not be contacting you, because they do understand and appreciate the work you do. So you have that good work-life balance. And I think when we came here, we did think of, after a few years, whether we need to go back, because we weren't completely sure. But I think what's changed my view on the whole thing is the opportunities you have for children and how much they can actually get of being in the system. And it changes your whole perspective, because the way children get taught is very different. And I think there is so much of emphasis on independence. There is a lot of emphasis on, and I think I'm sort of, from a female trainee's perspective on the whole thing, there is so much more which children get taught and they learn. And if you think you're worrying about how do you make the whole move about leaving your home country and coming out here and setting up, I think you actually embrace your roots and culture even more. And I think it's the whole thing about being away and missing your homeland more. You don't want your children to sort of lose that culture or tradition. You sort of consciously make extra efforts to make sure they are in touch with it all the time. So you sort of look into the opportunities of learning more over here. And you do develop a good social network over here. And I've been through the whole thing of celebrating the festivals, which I didn't celebrate in India, on a bigger, grander scale. So it's not a bad option at the end of the day. And I think you have a good setup, which Dr. Patkar sir and the team have put up, where you can sort of touch base with them to learn more. And if you have questions, this is the general overview, but if you have any specific questions which you want to ask specifically, feel free to just put down in the chat, and I'll try to answer them as much as I can. And it'll be mainly pediatric specific, because I'm not sure about other specialities. But hopefully you can sort of make your decisions based on our experience. And if you have specific questions, please do ask us. Thank you. Metusha, can you hear me?
Yeah, ma'am. Just a second.
Yes, Deepa, we heard it all, and it was really cool.
Thanks, Naveen.
Thank you, Deepa ma'am. And I think you have covered most of the points which are coming up in the chat box as queries. So maybe we can address few more questions. Naveen sir, can we take it later after the next session? So after this talk and all this guidance which we received about having a pediatric career in UK, now we have with us another special guest, that is Dr. Deepa Srinivasan. and ma'am will be sharing her journey from India to UK. She is fetal medicine consultant at Watford General Hospital, PhD research fellow at Imperial College London. We welcome you, ma'am, and over to you.
Um, Thank you for the kind introduction, and thank you to the team for putting together this whole program. I think the participants are going to find this invaluable because, of course, I did not face as much of a struggle as some of the others, but my journey has been uphill as well, as you would see, once I start going. Let me share my screen. So is everybody able to see the screen?
Yes, ma'am, we can see the screen.
Okay, fantastic. So the very first slide actually starts, talking about my journey. So when I came from India, I had a bunch of degrees with me, which I don't know whether it made it easier or made it more difficult for me to get a job. Because when I first came here, I thought that, I had completed my training. I was ready to enter as a registrar. However, most jobs asked me, have you worked in the UK? Have you? Are you able to do? Can you interpret CTG? Continuous CTGs? Can you do FPSs? Which is very different to how we practiced in India. I trained in Mumbai, and the system was completely different. The protocols, the guidance, and essentially, I decided to go into a non-training program to understand how the system works. Entered into an informal sort of training as a clinical fellow, completed my exams, took the Caesar pathway, completed specialist interests, which are called as ATSMs, and I will speak about that as we go along. Once I had completed this aspect of my training, I then decided to focus on my specialist interest, which was fetal medicine. So I then took a couple of years out to complete my certificate and my postgraduate diploma in ultrasound. And learning the essential skills, including the genetic components of fetal medicine, and I'm currently completing my MD in fetal medicine, and I'm also working as a fetal medicine consultant in the UK. So this slide talks about the specialty training and the education program, which is the formal training program that the Royal College offers you. So you can see that at the end of the foundation training program, you can enter into a run-through program. And you're expected to complete your exams at certain levels of training. So the part 1 MRCOG is a necessity before you are able to enter into the ST3. And towards the end of the ST5, you're expected to have completed your part 2 and the part 3 of MRCOG. And then you enter into an advanced stage of training where you are able to focus on your special interests. And by means of special interests, you can either enter into obstetric training or gynae training. The divide is more in the UK. So there are very few generalists, but more or less people are either they identify themselves as obstetricians or as gynecologists. And I will touch more on that as we go along. The way to do your specialist training is either you complete ATSMs or you enter into a subspecialty, which is essentially PhD students who have already demonstrated intense training and the sort of papers, they've done research in the specialty. They enter into a subspec, which is a 2-year program building on the knowledge that they've already acquired. So we then touch upon what route to take. So CCT, which is the run-through program that we spoke about, is a direct route. And Caesar is more of an uphill task. And this reflects my journey. So it's been extremely difficult completing the Caesar. but it was only because of a lack of guidance. And I'm really glad for, you know, training platforms like this, and I would love to support any CSER trainees, simply because once you know what to do, it is very easy to achieve this goal. So the reason many people choose CSER, and I can speak about myself, is because with the CCT, over your 7 years of training, you are moving through hospitals. Whereas with the CSER, you find that CSER you can complete in one hospital, and this sort of gave me the stability where I could focus on my family. I had young children, and I could spend a lot of time with them, be a mom, you know, taking them to their classes, schools, and things. So I found that very fulfilling. At the same time, with CSER, you can actually decide your own goals, your time frames. You can decide which pathway to take, and you can also sort of decide which place you want to work. If you feel that you're not getting all your training opportunities in a particular hospital, you can always move hospitals, and it is pretty straightforward. And the GMC is making it easier now, you know, with the new sort of system that they have introduced. The application is again through the GMC. On the flip side, I would say that this requires tremendous motivation, and it has to be yourself, you know, that actually pushes the training forward. And sometimes you may feel that there is a lack of support, and you know, it is a difficult and arduous task, and sometimes it can be quite lengthy. This is the core curricular program, and this is essentially the log book that the RCOG prescribes. So you will see that the clinical skills is a very small aspect of your training, and you're expected to demonstrate competence in a variety of other areas. So for instance, developing yourself, innovation and research, working in health organizations, leadership, emergency procedures, health promotion, how you are as a trainer and as a trainee. So there's lots of areas that are covered all through the training, and you are supported in developing these skills so that eventually when you do become a consultant, you are already well equipped to be able to perform in these roles. So moving on to the MRCOG, there are 3 levels at the moment. And the part 1 is the basic sciences. Part 2 and part 3 is where part 2 is more of a theoretical exam, and part 3 is where you have the OSCEs. It's like the Viva sort of system. I did not find the MRCOG particularly difficult, and I'm sure that a lot of the Indian doctors do not find this difficult, simply because our exams are much more intense. And once you enter into the Royal College system, you will understand that the way the system works is that it is mostly skill-based when you are doing the exams. So you are never asked the 10 different types of doing tubal sterilization. You will just be asked the one type that you use, and what will you do if you run into trouble. So it's very focused on practice, rather and very little on textbook knowledge. So if you do decide to follow a subspecialty route, you will need to have completed either an MD or a PhD, and or have publications in peer-reviewed journals. A minimum of at least 3 or 4 publications as a first author in peer-reviewed journals is a must. And this is now being conducted on a national level, and the interviews are very intense, and people take 6 months to train for these. And They're very committed individuals who I feel should be applying for this sort of a training. So there's you can apply for one of 4 specialties: so fertility, fetal medicine, gynae-onc, and urogynae. So the alternative to doing this is to complete ATSM. So when you say ATSM, this is an advanced training module, and you can complete this either in gynecology or in obstetrics. So in obstetrics, you can complete it in maternal medicine, fetal medicine, labor ward lead, high-risk pregnancies, and similarly in gynae, you can complete it in benign gynae, gynae-onc, menopause, hysteroscopy, colposcopy, and you need a minimum of 2 ATSMs to be able to apply for a consultant job, so that you are able to contribute to the organization. So you'll be running hysteroscopy clinics, and usually labor ward is a big part of your day-to-day working sort of job description. However, we do find that a lot of the gynae-onc people or a lot of the fetal medicine specialists are not covering labor ward. So you get the opportunity to decide what you would like to do as well, and all that will happen at the job planning when you take up your consultant job. Alternatively, a lot of trainees who have completed their CCT or CSER decide to follow the path of fellowships, where you are still contributing to the day-to-day running of the service, but at the same time you can acquire specialist skills in a very sort of specific area where you'll be running their clinics. You have assigned time for research, and you will be contributing to projects and audits, and will have protected time to complete your desires, essentially. So moving on to MSc, MD, and PhD. So MSc is just a simple, a taste of research where you're only looking at the basic sciences, whereas MD, you're translating your research into clinical practice, whereas PhD is building on what you've already done in your MD, and there has to be some lab-based element to your research. There are time constraints, and there's also a cost factor which plays a big role in which path you decide to do. So I have completed the PG certificate and the diploma, and in 6 months I could have completed the MSc. However, I decided to enroll for the MD program. I find that not everybody needs to do research. However, during your training you will definitely develop essential skills to be able to appraise papers, to critically evaluate your practice, and that is a basic requirement for any sort of consultant and consultant jobs. And I'm pretty sure you would acquire that skill if you enter into any sort of a training program in the UK. I would like to say a little bit about my journey, why I decided to do fetal medicine and decided to do research. So fetal medicine is a very young specialty, and it's constantly evolving, and there are new protocols, new guidelines, new algorithms, new interventions coming in every day, and I wanted to be a part of this. So having done my post-graduation in India, I had already done so much of obstetrics and gynecology that when I came here, I found it very difficult to decide which sort of specialization should I take. It's easy to do colposcopy, it's easy to do hysteroscopy. These are 6-month sort of training that you acquire the necessary skills. Fetal medicine is a bit more of an uphill task because you are expected to complete 3 different modules. And you have to understand the genetic component, you have to understand how the network works. So there are different DGHs, which are the smaller hospitals, and they are then connected through a fetal medicine network to the tertiary centers. and which is where the MDT takes place. So the complex cases are all discussed on a Monday or a Friday morning, where there's a panel of obstetricians, we have pediatric surgeons, we have neurologists, we have the genetic team. So about close to 50-60 people sit together and we brainstorm and we decide on the right sort of management, whether the patient should be transferred out to a different hospital. Will we need to organize surgery right at the beginning? We have the cardiologists who play a big role in the management, and so it's very exciting. It's fantastic subspecialization, and I would totally recommend it to anybody who, like me, is exhausted with doing labor ward and gynae. At the same time, if you've already developed your laparoscopy skills and you wish to pursue a sort of benign gynae or gynae onc, I'm sure you will be welcomed and they will appreciate your skills. So when I came here, having trained in Mumbai, people were very surprised to see that, oh, you can already do your hysterectomies, you can do so much of labor ward. The challenges are in understanding that so there's a lot more of communication that we do over here. So the decision is not is like, you leave it to the patient. You just explain the whole system. You explain that, oh, these are the various options and these are the sort of these are the risks that you'll be taking, and the onus is on them. Whereas in India, I found that I would say that lady, this is the safest thing for you, and I would totally recommend this. So it was understanding those sort of skills. I had to unlearn a few things before I could learn the new system. And then again, I had to justify. So if you do a cesarean section, you have to justify the reasons for it. There are meetings that are held. We're trying to constantly reduce the interventions. So you have to justify why you decide to take one route rather than the other. So I think that it's been a fantastic journey. I've enjoyed my journey, and I think that whichever route you decide to take, whether it is clinical, administrative, management, leadership, teaching and training, or to go down the academic route, I think the opportunities are fabulous, and I've enjoyed having the fabulous work-life balance. So I feel that I've been a very involved mom as well, as following my interests. So I will end there, and happy to answer any questions that you have. Thank you. Over to you, Mitusha.
Thank you, ma'am, for that absolutely wonderful session. And in a very short duration of time, I think you have covered a lot of important aspects. And it was truly inspirational. I think all those who are listening to us and planning to join these courses, you have enlightened them with the possible routes and advantage, and also telling them the importance of developing communication skills and other soft skills as well. So thank you once again, ma'am.
Thank you.
I think questions are coming up in the chat box, which Dr. Naveen and Dr. Shashank are constantly answering also. Shashank sir, I would like you to take over, and whichever you feel important to be discussed as a live chat, we can discuss that particular aspect from the chat box.
Yeah, definitely. We have tried and answered a few of them over here. I am seeing if there's any pertinent to pediatrics, if I've picked up anything, but I haven't seen anything in particular. Deepa, Dr. Deepa Shenoy, could you kindly just mention a couple of points around about NICU and how the NICU training goes about in UK? Because I saw some questions around MTI fellow coming and working in NICU. So maybe the neonatal aspect, if you could kindly just a couple of points and guidance on those lines, please.
Sure, Shashank. So in terms of neonatal training, so as a core pediatric skill, you do your neonatal training for 6 months in your ST1 to ST3 level, and you do another neonatal job for 6 months again towards the end of your completion of your training. But for people who want to do neonates as a subspecialty, you apply for the neonatal grid, which is the case with most of the subspecialties is at ST5, ST6 level. Once you've done your core pediatric competencies, you apply for specialist grids, and the neonatal grid is one of the other very competitive pediatric subspecialty grids. And it's a 3-year program. So once you apply for it, and if you get a national place, then you can do your 3 years just neonatal grid training. And in terms of MTIs, I think as with a lot of staff shortages we're having, with neonates especially, the shortage is even more significant. And most of the neonatal units are managed by neonatal grid trainees, but because the numbers are so low, a lot of people coming from overseas choose that as a specialty, mainly because it's easier to get a 2-year MTI program into neonatal units. And I know that in the Wessex region, in Southampton General Hospital, the MTI program has been doing really well over the last 5 or 6 years now. And there is at least 6 MTI trainees every year who come and rotate through that program. And some of them, I know there is difficulties with overstaying of the MTI beyond the 2-year program, but some of the MTI trainees have gone on to do additional roles. So because they have very close network and close tie-in with pediatric intensive care, a lot of these MTI trainees, because they're so good with their qualifications and they've got that expertise which they can share with the teams around here, they go on to do pediatric intensive care. So they work very closely. And I think it's a good scheme, because if you want to just come here for a couple of years to experience how the whole system works, the MTI is a good option. It's not for entry level, so it's not for people who've just done their primary MBBS qualification. It's mainly for people who've done their MD or they've got a diploma in pediatrics. So you should have pediatric expertise before you think about doing fellowship here.
That's really helpful, Deepa. And one more question before I get Naveen into a part of this discussion. We have retrieval units, isn't it? And how do they function? I mean, some people have a huge acute feeling where they would like to get involved in acute care of pediatrics. So could you put some highlight on that? Because that's, I think, a very specialist area, and there is a huge potential if people want to go back to India and carry on the practice.
I think retrieval, I think that's one of the very nice things in terms of how the retrieval services are set up. And I think I can talk mainly about the Wessex retrieval system. I think London's got a completely different retrieval system. So we have, as part of the deanery, the Wessex deanery, the neonatal retrieval system works out of Southampton General Hospital, and that's the main tertiary neonatal hospital over here. And that is the neonatal side of things. And they have the pediatric intensive care unit having their own retrieval system, and they work as a network between Southampton and Oxford. So it's a SOT network, and you have the neonatal, the SONET network. That again is a tie-up between Southampton and Oxford. So the SONET and the SOT networks are the two retrieval system. And I think if you come here as an MTI, say you're doing your 2-year MTI fellowship in either pediatric intensive care or neonatal care, you would be part of that system which learns about the retrieval thing. So, and you go to a lot of places, and as part of the intensive care, the SOT retrieval system, there is air ambulance as well. So your training would involve not just land. So you wouldn't be just going to a place retrieving very complex, very sick babies. You have to do the air retrieval. So there are little islands in the UK, and it is very close to the southwest of England, called as Channel Islands, and you've got Isle of Wight. So you do the air ambulance and retrieval service as part of it. And I think those experiences are invaluable. And I think most trainees find that, because it's not something which is very well set up back home. So that is a very good experience to take back if you don't want to sort of continue with your training over here. It's always a good experience to have, and you can always take it back and sort of develop that even more. So it is part of your training, and I think you'll be rostered in based on the rota, which is essentially how the system works over here, and you would have adequate experience. So if you show a special interest in it, they would definitely take you on as an extra member. So and there is great opportunities to develop, but you have to show the passion and your interest in wanting to learn the different things which they have to offer. So it is a two-way thing. You learn a lot from you, but at the same time, it is about your interest and what you want to get out of the system. So there is lots of learning and training opportunities.
That's really helpful. And may I just little bit expand on that point, what Dr. Deepa Shenoy has just mentioned. If you think you are a pediatrician with years of experience behind you, um, your objective should be in thinking, what am I going to learn and what am I going to contribute into the system? Because you have experience, do not undersell yourself. The one thing I have realized that some people, despite having an MD, years of experience, they try to undersell themselves. It's a fine balance. I'm not saying be overconfident and talk what you wish to, but you should learn to pitch at the right level and try and get that training. So if you're really keen to develop yourself in what has just been mentioned, MTI is a great route, and we can help you in preparing your CVs. And if we have time on our hand, we can also help you with probably some interview practice questions, because the skill is not just about your degrees and knowledge, it's about the ability to communicate within a team structure, because that's how these intensive cares and retrieval teams work. So thank you, Dr. Deepa Shenoy, for that excellent presentation and taking questions. And I know you have to rush to some very important commitment which she has every weekend. So we would like to thank you, but I'll hand over to Mitusha before I get Dr. Deepa Srinivasan and then Naveen into.
Thank you, Deepa. Thank you for being there.
Thank you very much for the opportunity. Thanks. Good luck, everyone. Bye.
I think, Shashank sir, you may continue, sir, with whichever.
That's all right. Yeah. Thank you, Mitusha. So I know I was trying to answer a few questions in the chat room, but the great area of interest when I see gynecologists across India, they have a huge interest in fetal medicine and fertility. And Dr. Deepa Srinivasan, she has kind of spent a lot of time in research and academics, which is a huge thing, because this is about generating new knowledge. And as a specialist who has actually done her CCT, is on specialist register, I want to ask you, would you recommend doctors to take up an MTI fellowship and have an experience with a particular specialist? For example, it could be in fetal or fertility clinic. Doctors who have already got MD, few years of experience, get that experience and go back? Or do you think they should actually spend more time generating new knowledge? Or do you think MTI fellowships is something appropriate for people with experience, post MD, post DGO with few years of experience?
So MTI is not a very well-established scheme in London. Although when I was, I think a few years back, when I was applying, it was one of the pathways that was open to me as well. And I know someone that came in, but he was in Scotland. I think that that if you've already developed an interest, and I would suggest, I would say that probably not fetal medicine, unless you've already acquired scanning skills. And I think in India the system is very different. It is more of a domain for the radiology department, and very few obstetricians are running the fetal medicine department in India. Whereas in the UK, we do not have any radiologists on our MDTs. It's essentially mostly obstetricians. We have the fetal medicine specialists. We have the maternal medicine doctors. We have cardiologists and pediatric neurologists. We have the pediatric surgeons. So the team generally comprises of this sort of specialities, and we do not have any radiologists. However, I do work with the radiology team closely because of my research. So I'm working in two areas, mainly on placentas. So I'm looking at MCDA placentas, and the other aspect of my research is on abnormally invasive placentas. So we're trying to predict the degree of invasion of placentas. So very technical things, and I would definitely say that if you have an area of interest, for example, early pregnancy, it is a very well developed system here. We have excellent protocols and guidelines. You know exactly what to do when in any particular situation. I think the training is more defined in areas like early pregnancy, for gynae-onc, for obstetric medicine. It's fabulous. If you are looking to do labor ward lead, where you're looking at a lot of risk, leadership, clinical governance, I would suggest, you know, these are areas that that you can develop in. I would think that if you've trained in India, you're operating at a very high level, and your surgical skills would be way above you know, an ST7 who is just about to become a consultant, and even some new consultants in the UK. Your surgical expertise would be way above the sort of training, because at the moment the way the system is that we are doing far less hysterectomies, we are doing far less interventions, because there is colposcopy, there's hysteroscopy, which are very well organized sort of departments and pathways. So you are doing very few surgeries. So so India, having worked there, I know that you know, we do a lot more hysterectomies, so I think your surgical skills will already be way above any new surgeon, new ST7. So I would say that
sorry to interrupt you, and this is exactly what I wanted to highlight in the next question. The key point over here is actually measuring or mapping yourself, because yours is a very surgical oriented, so it's a very skills oriented. So I think at an individual level, you need to map your skills where you are and be realistic about your training goals. Is that what you would something recommend?
Definitely, yes. I totally agree, because you can come here to learn gynae-onc, and in 2 years you will develop, because you will be learning communication skills, you'll be learning how to liaise with other teams, working in a multidisciplinary team and things like that. But if you think that you're going to develop your surgical skills, I would be a bit careful about you know, suggesting the MTI route for that.
But that's a very important point. So, I mean, there are a few things. So, what Dr. Srinivasan is trying to say over here is that if you have years of experience of surgical skills, then you come over here with an intention of learning the specialist areas. You can stay back and practice in this setup, or you take these skills back to you and go back. At the same time, if you're coming at post MBBS levels, you will acquire surgical skills, and these surgical skills are good enough for you to practice in a UK setup. A surgical skill, something that is adequate enough to practice in UK setup, and it's a safe practice, it's an excellent training. So this is a big point to understand. Yes, you will get the required skills to practice in setup if you're post MBBS, but if you have years of experience, then yes, you have all the surgical skills, but you have lots more to learn, which is mainly around safe obstetric and gynecology practice, and in fact develop into subspecialty training which this country offers. And you can either stay back and practice, or you can go back and take it back, go back to India and practice it in a different environment. So lots to learn, either as an academic or as a trainee, or as a trainee who wants to enhance their particular skills. So that's a very important point. And if anybody has any questions around the research, how to get into research, finding research topic, I have seen Dr. Srinivasan putting a lot of time, hours, nights, writing application forms, asking for funding, and finally, after 4-5 years of continuous perseverance, she did manage to get a good funding. Couple of lots of, I mean, it's an area where you have to have a lot of patience. Research, that's what is it. Research is the other name for research is patience. So it's a very, very dedicated field. So thank you for your valuable input. If you find any question in the chat box which is relevant to your specialty or area of interest, could you kindly answer those, please? Naveen, I'm just going to ask you, I know we have about 8 or 9 minutes before we submit, and Mitusha is already giving me that timing look. So I'm just wanted to ask very, very important thing. I've seen in the chat box, there are lots of doctors with years of experience. And between you and me, we have always talked about, is PLAB the route? Is exam the route? Is MRCP the route? and we know what we are talking about here, but you as a facilitator of careers and helping these doctors, can you just throw some light on that? Because it's a very important point, because the standard journey may not be the right journey, and you may probably have options which might work better for you. So Naveen, if you could highlight on that, please.
This is a very important and a discussion, because I think we have to understand the overall landscape of the things, and particularly at what your ambitions are, at what career level you are in India. For someone like who has just graduated post final year MBBS or has done internship, invariably I would think and say that PLAB is your best route, no alternatives to it. And that leads into, like, in India, I mean, nothing wrong about it, because that is the system how I've gone through, at least my experiences. It's a bit like a rat race. So we have PUC exams, you work really hard, you have your medical college entrance exam. After that, you have your final year, and then your postgraduate entrance exams, NEET exams. Once you finish it, you get married, and then you get into the race to become a registrar consultant again, and fellowship exam. Taking the time off in between to experience life elsewhere. I wouldn't say that, grass always looks greener, and then it's not necessarily just UK. It could be anywhere. It could be Maldives. It could be Dubai. I mean, taking that break to experience life a little bit is helpful. So maybe not just immediately after MBBS route, but after MD or MS. In that context, so I'll go back to the original. Post MBBS, PLAB is the best way. Post MD or MS or 3-year post graduation DNB in India, any specialty, if you have not done an UK Royal College exam, MRChem, MRCP, MRCOG, any of them, then definitely MTI is the alternate route, particularly if you think and see yourself that invariably I will have to go back to India, because my dad has got an hospital, my mom runs a charity I want to work with, my mom runs a hospital, I want to be her junior and then take over from her, or I want to stay in India, I want to bring that experience, MTI is the route. But if you have done any of the Royal College exams and aspire and see yourself, I mean, I came here, UK, thinking that I'll go back to India after 5 years of training myself. But then I'm settled here. I like the life here. There's nothing good or bad about, because we all comes with plus and minus. But if you would see yourself to stay a bit longer than 2 years in the UK, definitely I would advise do the membership route, follow the membership route, because that makes it easier. You will find a good job, better salary, and much higher chances of career progression. So MBBS and MS or MD and no Royal College exams. And if you have decided to stay here not more than 2 years, because I want to experience life, go to UK, see how the system works, travel to Spain or Greece every month or every other month. It's so easy. Going to Paris is like literally takes me around 12 pounds, and 3 hours I can be in Paris from London. If you plan it accordingly, 12 pounds is almost nothing. There's a bus which goes you with 8 pounds sometimes if you book in like 3 months in advance.
You're selling the dream, aren't you?
I'm not. As I say that, but if you want experience, then might be an MTI could be the route. And then you explore, enjoy life, and then see, there's no good. But you take this experience, go back to India, say, I'm UK returned, I've done my MRCS or MRCP whilst there, then MTI might be the route. But if you see that, right, I want to settle down, I want to raise my family there, good schools, everything are over here as well, healthcare system is good. Yes, salaries are not on par with the US. Then definitely any Royal College membership, MRCP, MRCOG, or FRC, or any of them.
What about people with years of experience? That's a very important point. What would you say? Years, I mean, so somebody's got 5 to 10 years experience post MD.
Shashank, can I speak on this? Yeah, can I address this question?
Please, yeah.
So we have this huge Caesar group where we have obstetricians and gynecologists who have years and years of experience, and they have come to the UK. And essentially they're in this situation where what do we do next? So I think the answer to that is one is Caesar route. And if you do decide to do the Caesar route, then I am the person to talk to, because I have done that. Of course, with a lot of support from Shashank. the other alternative would be to work in the country for a couple of years, because I would not recommend doing MRC. So I tried to do MRCOG part 2 from India, and I didn't pass. And when I came here, I worked for 6 months to 1 year, and then I sat the exam and I breezed through it. So I would definitely recommend working in the UK, simply because you don't understand about, so when they watch you counseling a patient and you don't know about the leaflets, the patient leaflets that you have to give out, you don't know about the MDT, that you'll discuss this at the MDT, and you don't know about the different channels that you can push the patient through. So I would definitely recommend working in the UK before you sit your exams. And secondly, if you have years and years of experience and you wish to complete your training in maybe 3 years or 4 years time and become a consultant, then I think that the easiest path would be Caesar. You have to show equivalence. It is not possible to show Indian training, Indian experience, because you can show the operation list that you've done. You can show that you've done a lot of labor ward. However, the specialist clinics that you're expected to have sat through is not possible. You have to show your communication skills. So this sort of demonstrating other areas of expertise is not possible from India. And we're supporting a lot of Indian trainees who have been consultants in Apollo, who've been consultants in government hospitals, and we're supporting these sort of Caesar people through it. So I would definitely think that Caesar is a very important route. Alternatively, you can enter into a training program. You can enter at either ST3, which is another 5 years of completion, more straightforward. But sometimes you may feel that you're being a bit undermined, or you can jump to the ST6 level, again, having done a couple of years as a clinical fellow. So sorry for jumping in, but I just felt that
that's really helpful. I mean, see, these are practical questions, and this is why we are here. Everybody's journey is different, and everybody's journey, we don't have the same journey to success. So everybody's needs are different. So we have to understand, and people are putting in chat box. Now, I wish I could spend more time and answer those questions, but if you have a complicated questions, like the last one which has just come through, and Naveen has shared his email. To be honest, we guys have say gone through this journey, but Naveen over here, what he's doing, he's spending a lot of his own time talking one-to-one, and that's really nice of him. So Naveen, if you could still engage with these doctors when they write an email to you, that would be very helpful. And I'm sure Dr. Patkar will appreciate, and his team will appreciate that time of yours. And again, I'll try my best, but you are more specialist and you understand the whole regulatory system very well than most of us. So really appreciate that. And we will take questions as a specialist in particular area. So I think that should be good enough to answer most of the questions in the Q&A session. So thank you, Mitusha, and I will hand it over back to you.
Just raise one point. I shared a lot of data and details with the Medverturials team. So I think, although I shared as primary contact, it is much easier and better because they have a lot more data compiled together, because my response times can be a bit longer. So if it comes through Medverturials, it is super easy because they can answer directly if needed. So invariably, always they are directly in touch with me. So your first portal of contact for anyone who wants to inquire and know about any stage, ideally is Medverturials. So there we have the WhatsApp and then the email ID. So I get forward from them as well if they cannot. So that is what I would say. Lastly, I think, thanks, Deepa, what you raised and mentioned absolutely is Caesar is the pathway for super experienced doctors. Otherwise, I think that it's like leaving rat race there and getting into a new rat race for CCT over here. Pointless. So Caesar is invariably the best pathway. One or two doctors have asked about particularly FRCR, and then if we could not give the final part, same applies with MRCOG. It's a very tricky space. There is no one answer, particularly because of the pandemic. They could not conduct the exams, and they canceled most recent FRCRs Part 2B in Apollo June this year. Yes, the wait is longer. We will get in touch and engage with GMC to see how is the best way to go through, but let's see. And the Medverturials team, once again, and Dr. Patkar, thanks for giving me the opportunity to speak.
Thank you, Naveen.
Thanks all of you, and the contact details, as Dr. Naveen also mentioned, they are on your screen. The mail IDs and the WhatsApp, so you can get in touch, and all your queries, we are going to try and sort them out. Because as Dr. Shashank mentioned, everybody's journey is different and all of us are at different milestones of our journey. So we hope that Med Virtuals can help you sort this out. So I would request Dr. Deepak Patkar sir to kindly close today's program with his message.
Mitusha, you can close. Thank you, Shashank. Thank you, Naveen. Thank you, Deepa. Thank you, Mitusha. Thank you, Mamta. Thank you, Gabri. And Amit, as always.
So thanks all of you, all the audience per se, for joining us. You are the most important part of the team. And be in touch. We'll be coming up with more of such focused programs and initiatives. And we'll be getting all the information to you through emails and various other social media platforms as well. Stay safe, stay connected. And thank you once again.
Thank you, everyone.